Welcome! Whether you're just starting your educational journey on contraception or here for a refresher, NCSD has you covered. Let's jump right in. As a public health professional, you may have patients with questions regarding their contraception options, and it's important to be prepared to have informed, inclusive, medically accurate, and culturally appropriate education to share. Often called birth control, contraception can be a variety of different methods used to prevent pregnancy, while some can also help prevent sexually transmitted infections or STIs. It's important to discuss with your patients where they are in their pregnancy timeline, options used to prevent STIs, and any other health conditions. These conversations help the patient decide which contraception method is best for them. Now there are short-acting and long-acting methods of contraception. If your patient discusses maybe not wanting to become pregnant now, but may sometime soon, short-acting contraception options may be what they're looking for. Short-acting contraceptive options are those which the patient will use daily, weekly, or even monthly in some cases. These can be discussed in two categories: barrier methods and hormonal methods. Barrier methods include internal condoms, external condoms, diaphragms, cervical caps, and the sponge. Short-acting hormonal methods include the ring, the patch, the shot, spermicide, birth control pills, and emergency contraceptives. Internal condoms are inserted directly into the vagina and are made of a synthetic rubber that someone must use each time they engage in intercourse. They keep sperm inside of the condom to prevent pregnancy and can also be a great method for preventing STIs. External condoms are worn over the penis and are often made of latex. For those with latex allergies, non-latex options are available. These also work to keep the sperm inside the condom, helping to prevent pregnancy and reduce the risk of STI transmission. Diaphragms are dome-shaped cups, often made of silicone, that are inserted directly into the vagina before having sexual intercourse. Diaphragms work to block sperm from reaching the uterus, helping to reduce pregnancy, but do not help to prevent STIs. It's recommended to pair the use of diaphragms with spermicide, which we'll discuss shortly. Cervical caps are similar to diaphragms, as the silicone-shaped cup is inserted directly into the vagina to prevent sperm from reaching the uterus. The ring is a small and flexible ring inserted directly into the vagina. The ring is left in place for 3 weeks at a time and then removed for the 4th week, and works by releasing hormones into the body that prevent ovaries from releasing eggs. It also helps create a mucus that helps to block sperm from reaching the uterus. The patch is a thin piece of plastic that is placed on the skin and releases hormones that prevent the release of eggs from the ovaries, while also thickening mucus in the cervix, which prevents sperm from ever reaching the egg. The shot contains progestin and lasts for 3 months. It works by preventing the ovaries from releasing eggs while creating a mucus to prevent sperm from reaching the egg. The sponge is a small rounded piece of plastic that is inserted directly into the vagina up to 24 hours before sex. It works by blocking sperm from reaching the cervix while also releasing spermicide to kill sperm that may be present. Spermicide comes in many forms and is used inside the vagina each time you have intercourse to help to kill sperm before they can cross the cervix and reach the uterus. Birth control pills, or oral contraception, is a pill taken daily, at the same time every day. The pill works by releasing hormones in the body that stop ovaries from releasing eggs and creating mucus that helps to prevent sperm from passing the cervix and reaching the uterus. It's important to discuss that there are both combination hormonal pills and progestin-only pills. One option may be preferable to patients who may have side effects or sensitivities, as well as those in postpartum. Emergency contraceptives are typically in pill form and help to prevent pregnancy before it starts and are best used up to 5 days after unprotected intercourse. Long-acting reversible contraceptives, LARC, help to provide protection anywhere from 3 to 12 years or until the person is ready for it to be removed. These typically come in 2 forms. Intrauterine devices, or IUDs, are small, plastic T-shaped devices that are inserted into the uterus of the patient by a medical provider. There are 2 different types of IUDs available, including copper IUDs and hormonal IUDs. Copper IUDs slowly release copper into the uterus, which keeps sperm from being able to fertilize an egg. Copper IUDs may be a preferred method for those who have had negative side effects with previously used hormonal methods. Hormonal IUDs release a hormone called progestin that thickens mucus in the cervix and prevents sperm from reaching or fertilizing an egg in the uterus while also suppressing ovulation. The implant is a very small rod that gets inserted under the skin of the patient's upper arm and releases progestin, like hormonal IUDs, that thickens the mucus in the cervix to prevent sperm from reaching or fertilizing an egg. Implants can be left in the body for up to 5 years or until the patient is ready to have it removed. In summary, there are a variety of contraceptive methods that are available to prevent pregnancy, and some of these contraceptive methods can also prevent sexually transmitted infections. Thanks for stopping by NCSD's Learning Center. Be sure to visit us again for additional learning and professional development opportunities.